Miocardico Medical Systems is introducing the Pixo Impulse System for acute coronary syndrome and heart failure patients. Short for pressure-controlled intermittent coronary sinus occlusion, the Miocardico Pixo Impulse System is an innovative new medical device designed to reduce infarct size and improve cardiac function post-PCI in acute coronary syndrome patients. A Pixo procedure is typically performed shortly after the stent revascularization is completed in the affected vessel. Here we see a coronary stent that has been placed to expand and clear the interior of a clogged left anterior descending coronary artery. In acute coronary syndrome patients with a typical infarct, even after a stent has been positioned successfully, local perfusion in the heart tissue can remain restricted, and reperfusion injury with cell death and inflammation persists even after revascularization. This simulated fluoroscopic examination demonstrates the limited flow of blood to the damaged heart muscle. The injected dye should flow freely from the main vessel to the arterioles and capillary bed, commonly referred to as myocardial blush. In this case, however, the contrast dye fails to reach the ischemic tissue, indicating what is commonly referred to as suboptimal myocardial blush and microcirculation. The Pixo procedure begins with the introduction of a guide sheath or guide wire via the femoral vein, the internal jugular vein, or the brachial vein. Here, a coronary sinus guide sheath is introduced through the internal jugular vein. It is carefully advanced along the venous circulation into the right atrium, ultimately stopping in the ostium of the coronary sinus. The Pixo Impulse catheter is then introduced through the guide sheath. Once the Pixo Impulse catheter is correctly positioned into the coronary sinus using the two marker bands as guidance, the sheath is withdrawn into the right atrium, where it remains for support. After an infarct, blood flow to the area of ischemic tissue is compromised, and unfortunately, even after the placement of a coronary stent, flow to this tissue can remain suboptimal. When inflated, the balloon of the Pixo Impulse catheter temporarily occludes the heart's venous outflow, creating an immediate increase in venous pressure. This increase in pressure is believed to redistribute flow into the border zone of the ischemic tissue. It is believed that the increase in venous pressure and flow redistribution caused by the temporary occlusion has the potential to reduce the infarct area and improve the overall cardiac function. The occlusion phase is individually adjusted to each patient. Miocardico's proprietary wean algorithm detects the pressure plateau and deflates the balloon when it is reached. During the occlusion phase, and for every heartbeat, the pressure in the coronary sinus increases to a plateau, which is different from patient to patient. Each heartbeat can be seen as a massage of the heart and the ischemic tissue. An examination of the blood flow from the left anterior descending coronary artery now reveals both an improvement in the myocardial blush, with more blood reaching the ischemic zone, and a reduced infarct size. The Pixo Impulse technology from Miocardico Medical Systems offers new hope for post-acute heart attack sufferers and holds the promise of improved outcomes for heart failure patients. For more information, visit Miocardico Medical Systems at www.miocardico.com.